I've been in the business. Let's just go. Here's my bio if you'd like to read it. But I've been in the clinical research arena for 35 plus years, starting out at a site as a coordinator and then moving to industry some 20 some odd years later. Started out as a monitor, was a study manager, site selection specialist, ended up in the quality group, not QA per se, but basically quality oversight, where we developed training and oversaw our vendors, which were both in the monitoring area and our study managers globally. I really always did some sort of training and always really loved the quality oversight piece, so I decided to branch out and do some independent consulting about a year ago. And that's what I'm doing now, doing all the things I love to do, teaching and doing quality oversight and working with CROs, sponsors, as well as sites. So that's kind of my history in a little bit of a nutshell. I have nothing to disclose, and that's me. I know it's hard when you're on a phone and not having a visual of someone, so I thought maybe I'd just stick a picture up there so you'd see what I look like. Our learning objectives for today: hopefully upon completion of this webinar, you will be able to critically assess the number of major and critical 2013 inspection findings. Those findings were released earlier this year, and we do have them listed, so you will be able to see what they were, both for the FDA and the EMA. We're going to also provide examples of the 2013 top inspection findings. You'll find my examples are taken from the FDA warning letters, and those FDA warning letters are accessible to the public. You will not find specific examples from the EMA only because of the privacy laws, and those are not made available. So we will see what the findings are, but we won't see the actual letters. We will only see those for the FDA. We will also be able to discuss how to prevent major and critical inspection findings. And we're going to apply the right corrective actions to resolve the major and critical inspection findings. And we're going to have situations where we're going to turn it around and ask what you would do in that situation and how you would handle these findings. So let's start off with the most common clinical investigator deficiencies. The most common thing today is failure to follow the investigational plan and or regulations. For many years, it was informed consent issues, and we can see that we've gotten much better with that because we are now down here. If you can see here, the very last one on this list here, number 6, is inadequate subject protection, including informed consent issues. Before, it was always number 1. So I think we're getting better about our informed consent issues, but we're not getting so we're not doing so well when it comes to following the investigational plan. So people are going off the grid, not following the protocol. We do have number 2 spot is protocol deviations. The 3rd is inadequate record keeping. 4th, inadequate accountability for the investigational product. 5th is inadequate communication with the IRB. And then, of course, as I mentioned, number 6 is informed consent issues. So a little knowledge check here. I would like you to use the panel on the right and just answer this question. And I know you'll be answering for the group. I guess, Erin, I don't know if you'll be the recorder, but one of you will be answering for the group. And if our other folks have joined, they'll be answering. What is the most frequent FDA inspection finding? Is it inadequate communication with the IRB, protocol deviations, failure to follow the investigational plan, or informed consent issues? Just put A, B, C, or D, your answer into the chat panel, please. Excellent. Okay. All right. Next. Some possible reasons for noncompliance. Let's take a look at those. Lack of time, lack of training, staff turnover, pressure from sponsor or PI to enroll. And I'm sure you're all very familiar with these. These are common threads in terms of noncompliance. What do we do about these? So if there's a lack of understanding of requirements, what would be our solution? Basically allocating qualified and trained people. So if you do have a site that you're monitoring or that you're overseeing, basically you want to ensure right from the beginning when you're doing that site selection piece that there is an understanding of the requirements, that people are adequately trained,